What's up, party people? Hey, it's Dr. Buck Parker, and as a general emergency and trauma surgeon over the last 10 years, I'm going to be reacting to some of the trauma scenes in some TV and movies, some that you probably know. And hey, listen, I know I'm not as good looking as some other YouTube doctors, but listen, I do have one thing going for me, and that is actual experience taking care of trauma patients like these. So let's jump into it.
Slow down, Danny.
Danny, I need you to slow down.
How about we all just get out and walk?
I need you to slow down, man.
Slower.
We're like we're playing live operation back here.
Okay, so it looks like this scene, the paramedics are inside the guy's abdomen. So I don't know, I've watched this movie before, but I can't remember if there was a wound already and she stuck her hand in there or she actually made an incision. But I'll have to say, if there was no incision before and the patient was awake, it's really not that realistic to make a giant abdominal incision in somebody that's awake already. I actually, as a resident, I think it was a second-year resident, I tried to make an incision, do a chest tube in somebody when they were awake and pretty lucid, but they had a pneumothorax, and I thought, oh, it's an emergency, which it wasn't. It was an emergency, but not quite as fast as I thought it was. So I tried to make an incision. The guy just jumped up and was like, "What the f are you doing, man? That it hurts." So yeah, it's not exactly that realistic, but if the patient was maybe out, I guess you can make an incision.
Hey, tell everyone to calm the down.
Aorta, yeah, I can feel it.
I need you to squeeze it now. Squeeze it hard to stop the blood to the fleet.
Now, when I was in residency, we did do some FaceTime stuff for surgery to sort of confirm with like 2 surgeons, but not in an emergency situation, obviously. So this is pretty not common.
My wife, she gets nervous all the time. You know what we do? We breathe. Do okay. I think he's waking up. I think he's waking up. Oh, yeah, he is fully awake. Oh.
So I think his heart rate was 40 right there. Usually with a heart rate of 40 in a trauma situation, most people are not waking up. They're almost dead. So that's unlikely. And then he punches the guy. I know he punches the guy here, but
Trying to save me. Oh, go to sleep.
I guess that can work. I don't know. I haven't tried it. I felt like I wanted to punch some people before, some patients, but I have not done that, I swear.
Colin, if this spleen ruptures, he's got 60 seconds.
I'm gonna grab it. I got it. Okay, I'm taking it out. I got the bullet. It's coming out.
Yeah, so this is another really big myth, is that you have to go in and take the bullet out. For trauma surgery, when you're operating, you're not going to get the bullet, you're going to fix whatever the bullet damaged. If perhaps you run into the bullet while you're in there, yes, you can remove it, but a lot of times we actually leave the bullets because, say, if they're behind a blood vessel or something like that, going to get it in a fragile area, if you're going to cause more damage, then sometimes we'll just leave it and just fix whatever it damaged. Does that make sense?
I almost got in.
Yeah, so I have had arteries squirt me in the face. That's for sure. One time I did that in an ER. I pulled the dressing off this guy with his radial artery cut, and it squirted me like literally right in the eye. I didn't have any eye protection on or anything like that because I thought I was cool. So wear your eye protection. But that typically doesn't happen like that. It looks like venous blood, number 1, because it's not bright red. And number 2, it's a big squirt. So like it's like a squirt like that. And artery squirts are very tiny. They're like teeny tiny squirts. So that's not the typical bleeding that you see if you have a lot of bleeding in the abdomen.
First, Colin, what do I do? I don't know what to do in this situation.
You gotta clamp that right now. He's gonna bleed out.
Hey, look at me. Listen. Do you know what we do? We breathe. Okay? That's all. We just breathe. Okay?
Yeah, he's actually making a really good point. So the first thing you do in an emergency when somebody's dying is you check your own pulse, and you have to realize that you're not the one dying. You have to stay calm so that way you can help somebody else. That's very important.
I gotta clamp me. I gotta clamp on my hair. I gotta clamp on my hair. Grab it. Okay, you gotta clip underneath. You gotta grab the artery. Fast. It worked.
Yeah, so that would never work ever. But that's a good thought. Anyway, I hope you guys enjoyed that reaction video. We got a lot more coming. Yes, I'm back. I know you didn't think I was back. I didn't think I was going to be back. But now that I don't have a job, I can pretty much say whatever I want. So it's going to be really fun. You guys stick around, and I'll see you in the next one.